A lobotomy, also known as a leucotomy, is a neurosurgical procedure that involves severing connections in the brain's prefrontal cortex. Developed in the early 20th century, it was initially intended to treat various mental health conditions. The procedure was pioneered in 1935 by Portuguese neurologist António Egas Moniz. Inspired by research on chimpanzees that exhibited reduced aggression after frontal lobe damage, Moniz hypothesized that similar interventions might alleviate psychiatric disorders in humans. His technique involved drilling holes into the skull and injecting alcohol to destroy specific brain fibers. Later, he refined the method by using a leucotome, an instrument designed to cut brain tissue. In the United States, neurologist Walter Freeman, along with neurosurgeon James Watts, adapted Moniz's technique in 1936. Freeman later developed the transorbital lobotomy, commonly known as the ice pick lobotomy, which involved inserting a sharp instrument through the eye socket to access the brain. This method allowed for quicker procedures without the need for an operating room or anesthesia, leading to its widespread use. Cell lobotomies gained popularity between the 1940s and 1950s as a treatment for severe mental illnesses such as schizophrenia, depression, and bipolar disorder. By 1951, nearly 20,000 lobotomies had been performed in the United States alone. The procedure was often seen as a last resort for patients who had not responded to other treatments. Despite initial reports of success, lobotomies were controversial due to their severe side effects and ethical implications. Many patients experienced significant personality changes, apathy, lack of initiative, and impaired cognitive functions. Some suffered from incontinence, seizures, and even death. Notably, the procedure was performed more frequently on women than men. A study in 1951 found that nearly 60% of American lobotomy patients were women. The advent of antipsychotic medications in the 1950s, such as chlorpromazine, also known as Thorazine, provided less invasive and more effective treatments for mental illnesses, leading to a decline in the use of lobotomies. By the 1970s, the procedure had fallen out of favor in most countries. António Egas Moniz was awarded the Nobel Prize in Physiology or Medicine in 1949 for his work on lobotomy, a decision that remains controversial given the procedure's ethical and medical ramifications. Today, lobotomy is viewed as a cautionary tale in the history of psychiatry, highlighting the importance of ethical considerations and rigorous scientific evaluation in medical treatments. Modern psychosurgical techniques are far more precise and are used only in extreme cases when all other treatments have failed. Procedures such as cingulotomy and capsulotomy target specific brain areas with the aim of minimizing side effects, reflecting the medical community's commitment to patient safety and ethical responsibility.